Let us now learn how to document the administration of drugs and what are the technologist's obligations during venipuncture or contrast administration, and what are the types of informed consents. The scope of practice for technologists should always be as followed. Technologists should follow the facility's rules and regulations before, during, and after intravenous IV injections. Laws and regulations specific to radiologic technologists depend on the institution in which they are working and the state laws governing technologists giving injections. Always follow the ASRT position statement, scope of practice, and standard of care. Failure to perform to a standard of care may result in a charge of negligence. The American College of Radiology, or ACR, allows for the injection of contrast media by licensed and certified technologists under the orders of a radiologist, provided that it is within the law of the state in which the technologist practices. The American College of Radiology, in Resolution Statement number 27, in 1987, approved of the injection of contrast material and diagnostic levels of radiopharmaceuticals by certified and/or licensed radiologic technologists and radiologic nurses under the direction of a radiologist or their physician designee who is personally and immediately available, if the practice is in compliance with institutional and state regulations. There must be a prior written approval by the medical director of the radiology department or service. The approval process follows established policies and procedures, and the radiologic technologist and radiologic nurses who have been approved maintain the appropriate documentation of continuing medical education relating to the materials being injected and to the procedures being performed. The prior written approval is sometimes called a standing order. Technologists are only authorized to administer contrast media or saline flushes in radiology. For all other medication, the technologist's role may be supportive, depending on the state and institutional policies. Before an IV or contrast injection, the technologist must follow all standing orders, standards of care, and policies of the institution where employed. Responsibilities include adequate patient interview to obtain any history of allergies or contraindications to the medication. It is the technologist's responsibility to keep up to date on standards of care and following standard orders. An example of a standing order would be a rule stating that patients with an abnormal BUN cannot receive IV contrast. Patients must give informed consent to undergo invasive procedures in which the drug, radiation, or instruments invade the body. Consent is given after a patient has received all available information about the risks and benefits of the procedure in addition to any alternatives. Consent must be obtained by a physician. It can be witnessed by a technologist. The technologist may be responsible for answering follow-up questions and, in some facilities, to witness a signature depending on the facility. Informed consent can be oral or written. An oral consent is binding but harder to prove. Implied consent is used only in emergency situations and must be authorized by the signatures of 2 physicians. Express consent can be oral or nonverbal, such as nodding of the head. The person to whom the consent is given must have the knowledge, skills, and technical ability to perform the task. Minors must have the consent of parents or legal guardians, and only an official interpreter is authorized to give consent for someone with limited English. Documentation is one of the most important aspects of contrast procedures. Be accurate. It should include the patient's name and medical record number, if it is available, the dosage and the type of drug administered, the lot number of the drug administered, the route of administration, the date of administration of the drug, the time of administration of the drug, the site of injection for parentally administered drugs, documentation of any reactions after administration of the drug, and the signature of the person administering the injection.
Thanks for watching. To purchase the full course and earn your CE credits, click on the link in the description or head on over to our website at www.medical-professionals.com. And while you're there, check out our All Access Pass, where you can get unlimited CE credits for your state and ARRT renewal for just $49.99. We also offer a host of free resources to make it easier than ever for radiologic technologists like you to achieve excellence. Check out our free Radiology CE webinars, clinical reference guides, and free CE courses on our website today. Be more than just certified. Choose medical professionals.